Hello, welcome to tonight's webinar, Supporting Women with Cardiomyopathy. Tonight's guest is WomenHeart. We're thrilled to have them in partnership with the DCM Foundation, and we'll get started in just a second. I'm Jayanne Rock. I will be your host this evening. I am the Director of Education and Information for the DCM Foundation. And behind the scenes, I have Justine helping us with the Zoom technology. I couldn't do this without her. We were just talking about that. Great, so let's get started. Next slide, please. First, just a couple of housekeeping items. Everyone's microphone is on mute upon joining. And please enter your questions at any time into the Q&A feature of Zoom, and we will hold a Q&A session at the end of tonight's presentation. So please feel free to drop those in at any point, and we will hold them until the end. Next slide. First, just a little overview here, just thinking in general about cardiomyopathy patients. We know that cardiomyopathy patients have diverse needs, so a single support group may not be able to address all of those needs. So that's why we want to connect you with a network of resources. And WomenHeart obviously is one of those fantastic resources. And we partner with several other heart-related organizations to offer a wide range of support. And that way you can benefit from a variety of programs and resources that are specifically designed for heart patients and their families. And we hope once you'll explore those organizations that you'll consider getting involved and consider participating in their efforts, and that way help support the heart community. So again, tonight we're excited to welcome WomenHeart. So let's get rolling. Next. WomenHeart is the first and only national patient-centered organization solely focused on supporting women with or at risk of heart disease. Tonight, we're going to learn about WomenHeart's efforts to support women with cardiomyopathy. We're going to hear about their support networks and online communities, as well as their amazing educational resources they provide, including webinars like this. They do amazing work in advocacy, and they're going to talk a little bit about that and how they help influence policy and research in this area. They also provide training for healthcare professionals. So really a wide array of offerings above and beyond, a little bit different certainly than what the DCM Foundation provides. And so you can connect with them and learn more. We'll then talk about how the DCM Foundation and the Genetic Cardiomyopathy Awareness Consortium are working with WomenHeart together to help women with cardiomyopathy, and then we'll open to a live Q&A. Next slide. So first, we're going to push a poll forward just to ask who is attending tonight's webinar. Are you a cardiomyopathy patient, a family member or friend, a medical professional, or an industry professional? It's always good for us to gauge who's interested in these topics. Just take a quick second. We're almost up there. Great, if we could end the poll and share the results. So as I suspected, almost 90% are patients or family member or friend. And then we have a small percent of medical professionals and industry professionals. So great, we're so glad you could join us tonight. Next slide, please. So I am thrilled to introduce to you Jodi Smith, Director of Strategic Partnerships for WomenHeart. We have worked with Jodi for several years now in a variety of capacities with a couple of different organizations, and we're just thrilled she could be with us. Jodi has a vast history in patient advocacy leadership. Before working at WomenHeart, she was 16 years the program director at the Mended Hearts, where she developed a number of programs for children and adults living with heart disease. She actually became involved in patient advocacy after her youngest son was born with a single ventricle heart condition, requiring 3 open heart surgeries. And before working in the nonprofit world, Jodi was an attorney. She was a litigation attorney, and she worked for Fortune 500 companies, and she also was an adjunct professor teaching leadership and law at the University of Richmond. And she brings all of this together to help support people living with cardiovascular disease as well as their families. So without further ado, next slide. I'm thrilled to introduce you to Jodi. Jodi, take it away. And Jodi's going to share in her own deck now. And thank you for being with us. We're just so thrilled you could be here, and we just love the partnership with you guys.
Oh my gosh, Jan, I am absolutely thrilled to be here. And DCM Foundation is a wonderful partner, and as you know, has been for many years. I am, again, Jodi Smith, and I am the Director of Strategic Alliances here. But I'm going to tell you a little bit more about who Women Heart is and all the amazing things that this organization does. So the mission, Women Heart was actually founded. It's our 25th anniversary. We were founded in 1999 by three women post heart attack who were realizing the lack of education, support, and resources available to them. And so they founded WomenHeart and made it our mission to improve the lives of women with or at risk for heart disease while fighting for equity in heart health. And we have done many things to that end. Our foundation is we are patient centered. We're committed to serving the needs of women with diagnosed heart disease. We also believe in empowerment. So we're not here to tell people what to do and try to make decisions for them. We're here to empower them to make decisions for themselves and to ask the right questions and to understand their diagnosis. And we also are stand for equity. So there are many health disparities, gender biases, and other issues with gender is one. But as we know, there are many other issues with minoritized populations that people face in terms of their diagnosis and treatment for heart disease. And we try to make our programs in a way that can help to remedy some of those disparities. So again, we had three women who had heart attacks and they formed Women Heart. And they mainly were concerned about misdiagnosis and delayed diagnosis, as well as health disparities. Also, many people understand like you can learn a lot about the educational pieces of heart disease, the educational aspects, but the emotional toll that heart disease takes on people is just astounding. We had two women heart champions speaking yesterday at Texas Heart Institute, and they were talking about how they felt so alone. They had a diagnosis of heart disease that changed their entire lives, and they felt like no one understood them or no one got them until they were connected with Women Heart, and they just cried and cried and cried because that connection meant everything to them. We are the largest patient advocacy organization solely focused on heart disease in women in the world. So why do we do what we do? I don't know how many people know these facts. Well, I do know that only 56% of women are aware of the risk of heart disease and death from heart disease, and that's a CDC statistic. But we have today more than 60 million women. That's 44%. That's more than one in three are living with heart disease. So if you are not living with heart disease, the chances are someone you know in your life is living with heart disease. And heart disease takes many forms. So it can take the form of high cholesterol, high blood pressure leading to heart disease, or it can be something like cardiomyopathy, which we're going to talk about today. Heart disease is it kills more women than all forms of cancer combined. Many people aren't aware of that, but it accounts for one in five female deaths. And in younger women, we see heart attacks rates increasing, and that's very alarming to us because the age of heart attack is getting younger and younger. Women are more likely to be misdiagnosed or receive a delayed diagnosis, and we are underrepresented in clinical trials. And that results in, so the guidelines, the care guidelines, clinical care guidelines are based off of data from clinical trials. And so if we're underrepresented, if there are only 20% of women in a clinical trial, then guess what? The guidelines are not based on women. They're based on men. So as I said, what do we do? So we have advocacy, education, and support, and we advocate for research and policies to improve women's heart health. We educate and empower women to make decisions and manage their condition, and we have many peer support services for women. So, why do we do what we do and how does it make a difference? So, patient advocacy and DCM Foundation is a wonderful example of a patient advocacy organization, but Women Heart is one that does its work specifically for women, improving access to healthcare and therapies, educating others and policymakers on issues women face, increase shared decision making and awareness of women's lived experiences. We amplify stories, addressing health inequities, empowering women and giving confidence, reducing healthcare costs, increasing health research in women and women's enrollment in clinical trials, and then making positive changes to policies. If you don't know about Women Heart, at the heart of Women Heart are our Women Heart champions. And so these are women who are living with heart disease, who are trained to take on roles in community, such as community education, advocacy roles, peer support roles, and they work nationally and in their communities, both. A lot of times people, when they want a speaker for something on women and heart disease, they get a Women Heart champion. They go through extensive training on heart disease basics, on telling their story, and on health equity issues. So they are leaders of support networks, community education programs, and advocacy. They participate on panels and advisory boards and in clinical trials. They give peer support online and they raise awareness of heart disease in women. And they also share their lived experiences, which is probably the most important thing we do. We share stories because stories can make all the difference in the world. We also have a National Hospital Alliance, and this is hospitals who partner with us that are committed to making a difference in women's heart health. And then in terms of cardiomyopathy, so we have exciting programs. Our one program that is directly geared towards cardiomyopathy is our clinical trial program. It's our ENACT program, and we're doing this in partnership with Mended Hearts. And ENACT stands for Empower, Navigate, Activate for Clinical Trials. We have the wonderful support of Cytokinetics, who supported this program. And it's an education and support program to empower patients to learn about clinical trials, activate them to enroll if appropriate, and help them navigate the trials. The goal of this program is to improve enrollment and retention in clinical trials, resulting in innovative therapies and effective and safe treatment options. As you can imagine, for Women Heart, we really want to increase enrollment in clinical trials among women because, again, we are underrepresented in a lot of cardiovascular disease clinical trials. There are some trials recently that we're very happy about that have been exclusively for women, or the majority of people enrolled were women, and that's in the device space, and we're really excited about that, and we hope that trend continues because we need information about women specifically to be able to create appropriate and effective therapies for women. The other things we do, and these are not directly cardiomyopathy, but they are cardiomyopathy in that we train people to work in the peer support space and other spaces for cardiomyopathy. So we train women, the Women Heart champions, and these are women with all different types of heart disease, and we do have women with different forms of cardiomyopathy, and we train them to be Women Heart champions. We actually just had a training at Mayo in Rochester, and we trained a whole group of Women Heart champions. And again, they'll go back and do work in their communities. But the nice thing about it is when we train women with cardiomyopathy, they can give peer support and have direct experience with cardiomyopathy. And that is really helpful for someone coming in and newly diagnosed with cardiomyopathy who wants to speak to someone or learn from someone who is trained. We also have our advocacy core, and so we take action on issues that impact women. The Hearts Act, it's been passed. I think it's been passed in the House, and that is about preparedness in schools for cardiac issues, and especially focused on things that would cause a sudden cardiac situation. And that is something we have supported, and we also support other actions which would help people living with cardiomyopathy. We also partner with other organizations, hence DCM Foundation, who is so wonderful. And there are many organizations that we partner with to work on programs. Some of the bigger ones, again, are Mended Hearts for the ENACT program. And then Global Heart Hub, we're part of that, as is DCM Foundation. Greg and I were just at that wonderful meeting. And they have a Think Cardiomyopathy campaign. That is a fantastic campaign, and we're all able to use pieces of it to help raise awareness about cardiomyopathy in our communities. And then we also do provide educational resources on managing heart disease. And so one of the ones we will be working on in 2025 is some more educational resources for women and cardiomyopathies. So that is something that's coming. But even if a woman has cardiomyopathy, often she can find really helpful and effective resources at womenheart.org to help her navigate her journey. So this is a quote directly from Women Heart Champions. I mean, several of them will say this in speeches they give, and I just think it's so powerful. My cardiologist saved my heart, but Women Heart saved my life. And I totally can get that. Like I know that with my experience with my son with a single ventricle heart condition, when I got connected to other parents, it saved my sanity. I don't know how I would have managed without that support. And now being part of Women Heart and just seeing the power of peer connection. I do know that it can save your life. A lot of women go into very severe depression with heart disease. A lot of people do in general, women and men. And getting that support or talking to someone who understands them can mean all the difference in the world. So that's what I have. And I know questions are at the end. So I will leave you with that and I will bring it back to JM.
Thank you so much, Jodi. Such amazing work you guys are doing. And by the way, I will send a follow-up email with the webinar recording and links to Women Heart and so forth after tonight's webinar. So next, the DCM Foundation, and many of you may know us, but there are some that may not if you've come in through Women Heart. So the DCM Foundation is a foundation designed specifically for people living with dilated cardiomyopathy and their families and to provide them with hope. So next slide, please. So our next speaker tonight is Greg Roof, the Executive Director of the DCM Foundation and the Genetic Cardiomyopathy Awareness Consortium, which he will talk about tonight. So 10 years ago, Greg was diagnosed with DCM and required an ICD. And then through genetic testing, it was revealed he has 3 mutations responsible for his DCM, and a number of his relatives carry those as well. So he retired from his work as an entrepreneur in 2017 and launched the DCM Foundation because there was no such entity for people living with DCM, and wanting to bring education, hope, and resources to patients and their family members. And then in 2023, we launched the Genetic Cardiomyopathy Awareness Consortium, which is a mouthful, but we call it GCAC for short. And that was to increase awareness about the role genetics plays in cardiomyopathy and the real need for more patients to get genetically tested. And Greg will talk about that. And so Greg actually ended up having a heart transplant just over 3 years ago, thank goodness. And he lives in Dublin with his wife, Brenda, of over 35 years. So let's continue on. Greg, we're so thrilled you could be with us tonight, and take it away.
Thanks, Jayanne, and thanks, Jodi. Get into that in a minute. If you guys have questions for any of us, Jodi, myself, or Jayanne, feel free to drop your questions in the Q&A, and we'd be happy to gather those and we'll answer them at the end of tonight's webinar. Again, would love to tell you how helpful Jodi has been. When we started the DCM Foundation, she was one of the first people that reached out, and we partnered on webinars and gathered a lot of information from her. So I think a big part of the success for the DCM Foundation is due in part to Jodi, and thank you for her help with, and she was at WomenHeart at that time, and then we were thrilled when she went over to WomenHeart, both great partners of ours. So thank you, Jodi, and we're pleased to partner with WomenHeart, and we're pleased to continue to work with you. So the DCM Foundation, those that were with us last week, this is a little bit different of a presentation. It's kind of similar in the beginning. So hopefully we won't bore you too much. But the DCM Foundation, we basically have three pillars. It's obviously for people, patients and family members with dilated cardiomyopathy. I started the foundation with Dr. Ray Hirschberger at Ohio State University, basically because there were well over 1 million people in the United States that have dilated cardiomyopathy, and there was no patient or family group, and not even a good website to explain dilated cardiomyopathy. So saw a huge need, and we started the foundation, and then brought in Kathy Gerspel, which I think is on the call today, our board president, Dr. Kathy Gerspel, and has been a real help to us. The first couple of years of the foundation, what we really have focused on is information education. Most of you get or have seen our monthly newsletters, obviously the webinars, the website that we do, in our social media. And we built a really strong, I think, for dilated cardiomyopathy patients and family members, we built, good numbers in people, attending our webinars, getting our newsletter, visiting our website. We're very pleased with that, looking at our social media posts. And we're also very thrilled with, as Jodi mentioned, sort of, heart and health equity. We also converted both the DCM Foundation website and the Genetic Cardiomyopathy Awareness Consortium website to full Spanish versions to help the Spanish-speaking population, not only in the United States, but abroad. And almost 25% of our traffic right now comes from people looking at the Spanish version of both websites. Other thing that we focus on is patient and family support with our support groups, resource information, conference, and engaging specialists. And I know that Jayanne and I and a number of volunteers talk with patients very regularly about going through their disease, and the fact that I actually have been transplanted. I talk with a lot of patients that are heading to transplant or have been recently transplanted. Happy to chat with them and talk about the journey. The third piece, which we're going to spend a lot of time, and actually the foundation has shifted a lot of energy into this, is genetic awareness. And we'll go into that a bit later, but we'll talk more about that in just a moment. Next slide, please. So DCM Foundation was founded in 2018. We actually became active in 2020. GCAC that I mentioned, or the Genetic Cardiomyopathy Awareness Consortium, the plan was developed in 2022 and launched in 2023. And we'll show you more on that in a few minutes. And then also we will be launching, which we're really excited about, in the first of the year, in partnership with NORD, we're launching a genetic cardiomyopathy registry, again, showing you a bit more about that later. We are looking to continue to explore cardiomyopathy US with GCAC members in 2025, which is, we're talking with the groups such as WomenHeart and the other GCAC partners. Do we want to put more of a formal cardiomyopathy US group, which you may see later 2025. The other exciting project that we're working on is we're working with an organization raising funds and sponsorship now to provide free genetic testing for cardiomyopathy patients and family members, looking to launch June 30th, 2025. This isn't complete and a done deal, but we're getting very, very close to making that happen, and we're really excited about that. Next slide, please. So kind of why have we shifted and put so much emphasis on cardiomyopathy and genetics? As I looked at this, and Jan looked at this, and the board looked at this, you know, we look at right now, there is no cure for cardiomyopathy at present time. We know that you get sick, you stay sick for a long time, you get a transplant, or your life ends, are sort of the outcomes. And it is estimated that cardiomyopathy affects about 2.5 million people in the United States. The most recent research, repeated research, has found that about 50% of cardiomyopathy patients' cases have a genetic basis. So 1.3 million people in the United States that have idiopathic cardiomyopathy. They don't know where it came from, most likely genetic. You know, that's the number, but only 1% of those patients are actually getting genetically tested, which is horrible, terrible indictment on our cardiology community. I'll go on and on and on. But because of this, genetic cardiomyopathy patients and family members are potentially dying. For instance, if you have a arrhythmogenic cardiomyopathy gene and you don't know it, you probably won't get fitted for an ICD, which could save your life, and those are your family members. And there are also, you know, there are treatment differences for genetic cardiomyopathy than regular cardiomyopathy. So you may not be getting the proper treatment. The other thing is that the lack of testing is hindering research and development of potential genetic therapies. And as we looked at potential cures and therapies, we'll go, next slide, please. We look at that, you know, this is a huge reason that we need to focus on genetics and cardiomyopathy. This is why we formed GCAC, you know, again, focusing all groups, you know, patient groups that deal with cardiomyopathy patients in one way or the other, really focusing on genetics. And we believe that helping solve this problem, getting more people tested, which will save lives immediately, will also, I think, spur the advancement of research and potential life-saving therapies, is going to be the way that we're going to save the most lives the fastest. Next slide, please. And that's why we've, you know, the DCM Foundation created in 2023 the Genetic Cardiomyopathy Awareness Consortium. Next slide, please. My apologies, I have a bit of a cold and cough, but please bear with me. So our GCAC partner groups that you can see, and the only reason WomenHeart are at the bottom right is because we did it in alphabetical order, but they are a very significant group. And you can see the 7 partner groups besides the DCM Foundation that we partner with in the Genetic Cardiomyopathy Awareness Consortium. Next slide, please. And with GCAC, there are 3 main areas of focus that we've been focusing on really the last year and a half, and we'll continue to strengthen and quicken our efforts in those areas. Is one, creating awareness. So we actually create awareness through WomenHeart, other groups, Mended Hearts, SADS, Danon Foundation, a number, and of course 4 or 5 other groups. So we're really taking the lead, creating, I think, what we call the genetics knowledge, the genetics expertise, and we're hoping to distribute that. And as we have been successful distributing it, not only the DCM Foundation, but the 7 other groups that we work with. We also are creating awareness through Facebook groups. Stephanie Fallon, that runs our Facebook groups, has over 10,000 people in the private and public dilated cardiomyopathy Facebook groups. And we also partner with about, which we'll go on a little bit later, about 150,000 people through other heart failure cardiomyopathy Facebook groups. We also are working heavily on identification. And so there's awareness, then we need to create identification. So we're starting a genetic cardiomyopathy registry, launching at the beginning of the year in partnership with NORD, if you know the rare disease organization, great organization also, and a great partner. And then we're working on greatly expanding the number of identified genetic cardiomyopathy patients through the free genetic testing option that I discussed earlier, and we'll go into some more detail. Next slide, please. Awareness that we just talked about. How are we creating more awareness about genetics and cardiomyopathy? Is through the 8 patient groups that we're working with. They have collective membership that well exceeds 100,000 people, patients and family members. Excuse me, please. We've also partnered with Stephanie and Jayanne have forged partnership with over 30 Facebook groups that deal with heart failure, cardiomyopathy, transplant, women and heart, that represent over 150,000 patient family members. That's how we're getting the word out to them. We also have 12 gene-specific face group, 9 of which we've started ourselves, and 3 that existed and we're now partnering with. And we think that this is the gene-specific groups are a big growth area. And if you have a specific gene that is causing your cardiomyopathy, if you're here and have cardiomyopathy, we'd go to our website, look for the gene-specific groups and join if represented. If not, we would love to be able to, if you would like to be an admin for a Facebook group and start a new Facebook group, we'd be happy to work with you on that. But we find people get support and like to communicate with folks that have the same genetic mutation. And this is an area that we've really grown dramatically the last year and a half to help patients with genetic cardiomyopathy. So we also will continue our outreach to the cardiology and heart failure community. Again, it's interesting that in 2025, 50% of cardiomyopathy patients probably have a genetic basis. 1% get tested. It means 49% aren't getting tested, which is terrible. Even though the American Heart Association, American College of Cardiology, and Heart Failure Society of America guidelines say they should. So if you are interested in helping us get this outreach, talk to your doc about how you can, we can get more information to the hospital that you're working with or the medical center. And then we also would like you to join our advocacy army that is on our Genetic Cardiomyopathy Awareness Consortium website, which is www.geneticcardiomyopathy.org. Next slide, please. We're really excited about launching our genetic cardiomyopathy patient registry. This began really probably over a year ago. We started probably a year and a half ago, 2 years, we started looking for potential partner solutions to create a registry, a patient registry for genetics and cardiomyopathy. And we decided to partner with Nord on this. We're very excited we did. We definitely picked the right partner. And we actually have been working on this for the last 10 months on a weekly basis, creating everything that's necessary to create an FDA IRB approved medical registry. We're pretty excited about that, and would like to give a shout out to Kathy Crispell, I believe is on the call, board chair, Dr. Beth Rousseau, and obviously JN for doing a lot of the work on this and getting us ready. The information would include demographic information, genetic testing results. You can upload your test report, medical history, and family history. And really what we want people to do is make themselves available for potential research, future research and clinical trials. We think it's so important. So if you're here tonight, obviously, as we start sending materials out at the first of the year, and you've been genetically tested and would like to participate, we strongly encourage you to participate in this registry. We believe that it potentially could help save lives in the future. Next slide. So one of the things that we're actually doing, so to grow the pool. So awareness is out there, but as we know, only 1% of the people have been tested. So with our registry, we're going to have those 1% of the people register, but the other piece is to get more people tested. And so we've been working with a number of actually patient investors, patient with cardiomyopathy, that would be willing to invest in a business to create free genetic testing for cardiomyopathy patients. We're excited. We've got everything just about together. We're really excited about that. You know, as I mentioned before, you know, the medical industry is not getting the job done here. So we feel that we have to go out on our own and do this. We have to tell people to get tested. Excuse me. I think we have to provide options for cardiologists, outsourced options to get genetically tested and provide genetic counseling to test it. And we think we also have to make the process, excuse me, we've heard hundreds and hundreds of times that the genetic testing process is like a death by 1,000 cuts. Actually jumping through the hoops, dealing with insurance, not knowing if it's going to be free, not knowing if it's going to be covered, not knowing if my copay is going to be $4,000 or a penny. And we've heard all those things. And so we feel that the best option in this for us to do is to create a free option and a very simple app or online system that you could get tested, get the spit test sent to your home, and have the option, if you have a positive test, of talking with a genetic counselor. Really excited about this, and you'll see more information Q1 2025 about this. Next slide, please. Excuse me, again. And so, you know, although there is no cure for cardiomyopathy, we really believe that gene therapy in its current form or future forms is going to be a strong hope for many cardiomyopathy patients. And that by getting more people genetically tested, getting more people, you know, willing to be in research studies and clinical trials, that we can help clinical, you know, quicken the pace of therapy development. And we believe that this is a huge, strong help in the future to create hope and potential cures for all those affected with the disease. Next slide. Jan?
Great. Thanks so much, Greg. Sorry for your cough. We've all been there. 'Tis the season. Even my dog has allergies this season, so that's not good. No, thank you both for this amazing information. Please, I encourage everyone, whatever your question, please drop it into the Q&A feature at the bottom of your screen. You just click on the Q&A and you type in your question. You can do it anonymously or with your name, but we do encourage you, now's the time. So let's see, we have a question that came in for Jodi. Does your organization have any links with similar organizations in the UK, specifically Scotland? I'm having difficulty accessing appropriate support and specialty of cardiomyopathy. I'm newly diagnosed.
Yeah, yeah, we all do. There's an organization called Cardiomyopathy UK. We were just with them in the UK. So, but they have all sorts of support and other resources. In fact, it was Joel, wasn't it, Greg, who was a speaker for a lot of the sessions. So he's amazing. He is the leader of that organization. And I just looked it up, and I think it's just cardiomyopathy.org or something. I mean,
Yeah, I
it's,
think, cardiomyopathy.org, yeah. Or just Google search cardiomyopathy UK. It'll come up.
yeah, but it's it is easy to find, and you can also get support there as well as all sorts of resources.
Yeah, fantastic group. Thank you. So this question just came in. Do you know what the different types of cardiomyopathy testing that are available? So for genetic testing, I'm assuming that means for genetic testing. Are there different kinds of genetic tests that are available? Greg, do you want to take that one?
Yes, and again, I realize that I am not a certified genetic counselor. I'm not a geneticist. I'm not a medical doctor. So I am a patient giving you an answer. So I want to qualify that, but kind of it is confusing. It's interesting, and so I'll try to boil it down on maybe just a patient level. And you know, there are a lot of different types of genetic testing, and so one is just providing a test for a cardiomyopathy panel. which would be all of the known genes that potentially cause cardiomyopathy. They could give you a test. And a lot of the tests you can actually, it's a spit test sent to home, real easy, fill something out online, they send it to you. And then more and more, we're starting to seeing kind of a mix where, they'll do the cardiomyopathy panel, but there'll be a genome sequencing, complete genome sequencing on the back end. And so as researchers and drug therapy companies are trying to figure out, they want to get a broader of just the genes that are misspelled or mutated in cardiomyopathy, because what they're finding is that they I think in the future they want to look at your complete genome sequencing to see, why does yours manifest a certain way? For instance, in my family, I have 3 gene mutations that could cause cardiomyopathy. Been transplanted. My sister, who's 2 years older, has 3 gene mutations, and she's fine, basically. Why did that happen? So they kind of like to look, I think, deeper into your, your medical history, also your complete genome, to see, are there other genes that are, things that are going on that can either repress or aggravate, accentuate the disease and cardiomyopathy. Again, that is a 9th grade answer to a very complicated question, but hopefully that helped. So cardiomyopathy panel and complete genome sequencing, and they can be done together. And one of the things that we're looking at is just, maybe, because I think it's important for researchers to get as broad of information as possible for that. Good question.
Yeah, great. Thank you, Greg. The next question from Sarah about genetic testing. And I'm not sure if she's just talking about genetic testing or also the registry. She's asking, what steps are there to protect my information now and in the future? Will my information be sold? So I guess first, let's take it from a genetic testing perspective. Yeah. And then maybe we can talk about the registry.
Yeah, I think that is a huge issue and a great question. And so again, this is a patient speaking. So we think that, so anytime you are going through a medical grade, so to do our genetic testing, to do the registry, we have to go through and get IRB approval, which is a formal medical review approval, right? And there is a lot of HIPAA compliance you have to comply, which means you can't, do anything with your information without your specific consent. So, and generally how the registry would work is if you uploaded your information, there would be a question on it that would say, would you be interested in being contacted for future research studies and clinical trials? And this is how we'll do it. And I think most that have to have IRB approval, which is you have to have medical approval for this. The sort of the other bigger, DNA testing companies, I don't know if they have to go through this or not, but certainly anything involved in the medical industry, which our registry is and genetic testing is, we have to comply to this. So you'd be asked the question, would you be interested in having your information, potentially, be forwarded to, not be forwarded to, available to, future researchers, academic researchers, and clinical trials. And if you answer yes to that, what will happen is if somebody came to us and said, we're looking for people for this research study that has this, this, and this, and if you actually met those criteria, we would then reach out to you and says, hey, it looks like your information matched a research study that's going on or a potential clinical trial. And would you be willing to have your information forwarded to this, research study or clinical trial? And only then, if you answer yes to that, then the contact would be made. So, in what we're doing, and I think in any of the IRB approved studies where you get genetic testing, that in registry would have to comply with the same standards. They're very, very strict about that. So your information is safe. It has to go through, not only HIPAA medical sort of security requirements, but at the same time, it also has to go through, all of the technology security, high-end security requirements too. I don't think anything you put on the internet is 100% safe all the time. but you will be given maximum protection with that. So I hope that answers your question.
Excellent, thank you. We're going to stay on the registry topic for a minute here, and then I have a couple of questions for Jodi. So people who are interested in joining the registry, someone asked for the link. The registry is not live yet. It will go live late this year, early next year, and everyone will be notified. You will automatically be on our email list now because you've joined this webinar, and we will be sending out information to everyone on our list about the registry once it goes live and how you can participate. So thank you, great question. And we do hope that you will participate. The other question here is, I'm interested in hearing more about how you are reaching people with genetic cardiomyopathy for the registry. How are they recruited? Do they sign up via an online platform? And it is online, but if you want to talk again about how we are reaching people with genetic cardiomyopathy.
Jan, do you want to answer that? You're the one that does all this. I generally kind of how it works, the DCM Foundation. Jan does all the work and I take all the credit. So
he's the idea guy. No, they're good ideas.
But no, Jan actually does all this. So go ahead.
So what I can tell you first is that it will be an online platform, and you will be able to register for the platform through our GCAC website. So you'll go to geneticcardiomyopathy.org. You will click on join the registry, and there you'll be walked through all of the steps and consents and so forth. In terms of reaching people, again, just to reiterate a little bit what Greg said earlier, Stephanie Fallon runs a couple of Facebook groups that are DCM specific. One is a public group, one is a private group. There are a total of over 10,000 members now between those two groups. She is the admin, and we work closely with her to inform people about webinars, clinical trials, research going on, et cetera. And then through that, through the work with that, we've also identified a number of there's like 30 or more groups that are heart failure related and cardiomyopathy related. Some of them are pediatric cardiomyopathy related. And so we now have connected with all of those groups, and we have been given permission to post information in those groups. So that's how we're reaching. And among all those groups, we now have over 150,000 people we can reach who have cardiomyopathy. And of course, a portion of those then also have genetic cardiomyopathy. So great question. And we promote regularly through those channels.
And I didn't bring up before too, real quick. We partner with NORD. So we're actually using the NORD platform. And it's a nonprofit organization representing rare disease groups. And so we feel comfortable. They're a very similar organization like ours. And I think they're working with 60 now groups.
There's many.
So 60 different registries. So they do this a lot and are extremely compliant, with all aspects of the law and FDA and everything. So
they've been a great partner to work with. Yeah. So they have like over 50 or 60 other rare disease organizations that they have stood up registries for. And those registries are now recruiting. So we're working with them, and they've been amazing. So Jodi, a couple of questions for you. What does it take to become a WomenHeart champion? What does that involve for anyone who's interested in going that route? What can you tell us about that and what that means?
Yeah, so you can, as any woman right now, can connect with WomenHeart in a variety of ways, get through our peer support, our support networks, our community groups. But if you want to be a WomenHeart champion, it's a little bit more. There's a fairly extensive training that you would go through. So there is training online, like pre-training to the WomenHeart Champion training live at Mayo. That is just again, going over some of the basics of heart disease. You don't need to become an expert or anything in heart disease, but some of the basics, and information about heart disease and health equity. So when you get into the training, you have a background. And then the training is, it's always over Indigenous Peoples Weekend in October, and it is up in Rochester, Minnesota at the Mayo Clinic. And the Mayo Clinic leads a lot of it. And we have that one, Dr. Sharon Hayes, who's huge. She's one of the heads of cardiology over there, and she's just amazing. And she helps with the curriculum and leading the program and many speakers from Mayo Clinic. And then there's a tour of the Mayo Clinic as well. And then there's some post training, a little bit of post training work to do. Now, when you decide to become a WomenHeart champion, it means you want to do much more. And so you're not just a person living with heart disease who's connected to WomenHeart, but you want to do either education or support in your communities, and and it can be big support or little support. You can have a book group, you can do educational programs, with your exercise, your walking group, or whatever you're involved in. You don't have to have like this big thing, but you can work with the hospital and have a nice big support group and help women that way. And so we also have our Red Bags of Courage that has a bunch of educational pieces, and the WomenHeart Champions often give those. We have a visiting program for women in the hospital, and they give those with one of the red scarves to women in the hospital. And we know how amazing that can be to have someone come in and who's been there, done that, and they're just like, they're living their life, and you can see that. And so those are the things that WomenHeart champions commit to. And we ask that you commit to like a 2-year commitment. And we have many champions who've been here for 20 years, 15, 20 years. They love it.
Yeah,
They keep going.
I see the pictures all the time, and it looks like it becomes kind of like a family,
It
where
it
people come to know one another.
It is like a family. It's this connection that is just so amazing. And when they come together at events that we have, you just can feel this. It's like this amazing energy of connection and sisterhood. It's really cool.
I will ask you just one more question. So if someone wants to connect with a peer woman with cardiomyopathy or support, do they go to your website to look how to do that?
Yes, the best way is we have a program called Heart Sisters Online, and the best way is to send a message through there, because then we have WomenHeart champions who will help with that program and make sure that they get connected. We do have a sister match app, and that works well for some people who like that app kind of connection. So it just depends on what kind of connection you like. You can also find a support network in your community if there is one there that's online, and you can search it on the WomenHeart website as well.
Fantastic. And again, I will put that link in the email, the follow-up email, along with the webinar recording.
Wonderful.
Jodi, thank you for that. That's awesome. Let's see, a couple more questions have come in. Christina said, I was diagnosed with idiopathic DCM in 2021. I was not recommended by my cardiomyopathy specialist at a known medical facility. Got genetically tested on my own, and the results were negative, but the geneticist recommends I be tested again within 4 to 5 years, as genes are being recognized more and more. And I can't stress that enough. That's absolutely what we hear. Greg, did you want to weigh in on that at all?
Yeah. Hey, Christina, great question. And great point to bring up. I think it's, even the big medical centers don't, and they'll all admit it, that do genetics and cardiomyopathy don't do enough testing. So, if you're diagnosed with idiopathic cardiomyopathy, they don't know where it came from. Really demand push to get tested, genetically tested. And the second thing is when you get your test results, it's really important to talk with a genetic counselor on the back end. Because one of the things is, a lot of people have a family history of cardiomyopathy, but for some reason, the gene has not been discovered, detected. It can't be detected on the panel. It's evolving and not perfect. So it's also really important that if you have cardiomyopathy, you talk with a genetic counselor, and they'll say, well, you're gonna be medically treated, and we believe you have genetic cardiomyopathy. We just can't identify the gene yet. And that's really important, and you follow that protocol. So it's really, really important that even if you come with the negative gene, you have a family history, that you talk with a genetic counselor, and they can direct you to get the proper treatment, not only for you, but also your family members. Great, great, great point to bring up. Thank you.
Absolutely. And someone just asked, how do I talk to my family? How do I talk to my cardiologist, sorry, about getting genetically tested? And we do have resources. If you go to geneticcardiomyopathy.org, and there you will see there's chat with your doctor. There's actually a PDF you can print out and bring with you. So anyone who's interested, if you didn't catch that, you can email me directly and I can send it to you. My email address is jrock, JROCK, at DCMFoundation.org.
And I'd be happy to chat with you too. So happy.
Absolutely. A couple other quick questions, and then we'll wrap up. At what age does this show up in regards to testing? I was diagnosed last year at 69. My kids are 44 and 46.
Again, patient, not doctor, not genetic counselor, not geneticist. But I think it really varies, and that's why it's, so I think maybe a question is, should my kids get tested, even though it didn't show up to me when I was in my late 60s? And I think that's really important, that you, hopefully when you were tested, you had a conversation with the genetic counselor. If you still have that contact information, you also can go to the National Society of Genetic Counselors, nsgc.org, and locate genetic counselors in your area that you potentially could chat with. I think that's really, really important. But I don't think there is an age, a particular age. What I have seen personally is that, certainly certain mutations of genetic cardiomyopathy can mutate at different times, early on, later on, mostly I think it's 40s, 50s, 60s. I'd recommend to talk to your doc and talk to a genetic counselor about when to get tested. But I think the answer is there is no known time that people should get tested, and there is no known time when the disease will actually, a genetic mutation will actually start causing disease. So, but it's important to know you have the genetic mutation so you can be followed. So for instance, because as I mentioned before, if it's a gene that potentially could cause arrhythmias, it's important that family members are tested that would have the option of potentially getting an ICD, which could save their life. It's also important that if you get tested, you have a genetic mutation, which again doesn't mean you're going to get sick, and doesn't say when you're going to get sick, but it's important that the doctors can follow you, so that at the first, if it does progress into disease state or cause cardiomyopathy, they can start, certainly drug therapies and different types of therapies as early as possible to slow the onset of the disease.
Oh, excellent. Great answer. Thank you. And so we're going to wrap up here. I just had one other comment for Jodi. Patty Farmer commented, she's a WomenHeart champion. Would it be possible that brochures about cardiomyopathy and more information about genetic testing could be placed in the red badge of courage? And Jodi will be happy to work with you to figure that out if we can make that happen.
That's coming 2025. So.
Okay, great. Excellent idea. Jodi, thank you again for being with us tonight. We just so appreciate your partnership and all that WomenHeart does. I cannot stress it enough. People, just go check out WomenHeart.org. It's amazing that the amount of things that you all do is just fantastic, and the advocacy piece is huge. So thank you for everything you do, Jodi. Thank you for being such a great supporter and partner of ours for all these years. Greg, of course, thanks for all the work that you do in presenting tonight. So let's finish up with the slides. Jodi, if you could pop in our slides one last time. We have a couple of last notes. And great, these are all of our corporate sponsors and partner groups and our additional partners there at the bottom. I mean, without this group of organizations, all of these logos you see here, we wouldn't be able to do nearly what we've achieved. So thank you to each and every one of them. Next slide. Again, for more information about WomenHeart, go to WomenHeart.org. the DCM Foundation. You can check that out at dcmfoundation.org. A lot of questions tonight about genetics and cardiomyopathy. Please go to geneticcardiomyopathy.org. Tremendous information there if you haven't checked that out before. And that is where the registry ultimately will be able to be accessed once it launches early next year, late this year. Next slide. And we hope you will join us for our next webinar. We're very excited. Wednesday, December 18th from 6 to 7 p.m. Eastern Time. We will be talking with Tanaya about gene therapy breakthroughs for cardiomyopathy, and they're going to be sharing some insights about their clinical trials. You don't want to miss this. It's like incredible stuff coming down the line here. So please go to our website and sign up. I will also include sign up information in the follow-up email along with the recording. If you have any questions that weren't answered tonight, or if you want to reach out and connect with myself or Greg or Jodi, please email me directly at jrock, JROCK, at dcmfoundation.org. I'm happy to help you or direct you and connect you with any resource. So thank you again. Next slide. Hope you all have a wonderful evening, and we will hopefully see you again on December 18th. Jodi, thanks again. We really appreciate having you. Okay, take care, everyone.
Thank you, Jan. Thanks, Greg. Bye.
Have a great night, and thank you to Justine, as always, behind the scenes. Okay, good night,
Bye.
everyone.